Hi, I'm Dr. Daljeet Kaur. I am a consultant psychiatrist in Hyderabad. 21st September is World Alzheimer's Day, and I'm here today to talk to you and give you some basic understanding about Alzheimer's dementia. Alzheimer's disease is the most common cause of dementia. There are various other types of dementia like vascular dementia, mixed dementia, Lewy body dementia, and frontotemporal dementia. However, this being the World Alzheimer's Day, I would like to stick on to the topic of Alzheimer's dementia. Now, why do we need to understand about dementia and act on it? Well, early intervention is the key to any problem. So let us today, as friends, as relatives, and as best wishers, learn to identify the symptoms of dementia so we can get our loved ones the right help at the right time. So the word dementia describes a set of symptoms that may include memory loss, difficulties in language, difficulties in the thought process, difficulties with problem solving, and possible mood changes. Now, these difficulties that we talk about might become significant for a person with dementia because it will start affecting their day-to-day life. So let's talk about the symptoms a bit more in detail. A person with dementia will have problems recalling events of day-to-day life. For example, they might not remember if they've kept something somewhere. Say they've kept the keys, don't remember. They might have forgotten to switch off the cooker, if they are still functional and working in the kitchen. They might forget if they've had their medication that day or whether they've had their breakfast or meal. So these are things to watch out for. There can be difficulties making decisions, even sometimes to the extent of financial, decisions. So when we identify dementia in the early stages, we recommend people to make, life decisions, like advanced decisions for their life. There can be difficulties solving problems and carrying out sequence of tasks. So what, things to look out for is, suppose, they've gone out to a grocery shop, then are they able to actually buy something, plan well, and get the change, because they might have difficulty calculating and understanding how much they need to pay. Other tasks maybe for someone at home would be something as simple as cooking a meal or making tea, because they have to follow certain steps and plan for it. There can be difficulties in following a conversation or even word finding difficulties. So you would often find people saying, oh, well, the word it's just on the tip of the tongue, but I'm not able to get it. So this is not the only symptom, because this can also happen in normal aging, but these are, few of the symptoms that we need to watch out for. They might have problems with the visuospatial skills. So they might struggle to understand or judge the distance of the stairs, and this might increase the risk of falls. They might struggle to see objects in 3 dimensions. So what I ask, people is, when they are at their own house, and are there times when they actually forget which is their room, which way to go, or if they've gone out of the house, do they just wander off? Are they struggling to understand which is the way to come back to their house? So these simple questions need to be asked. Other thing is losing track of the day, date, time. So we're looking at the orientation part. So here we can help people by keeping some calendars and prompts so they know which day of the month it is. So, there are lots of things that need to be done, which we can, look into later. Now, mood-wise also there can be few changes. So a person can be, coming across as frustrated, agitated, anxious, or sometimes withdrawn. So there can be behavioral and psychological symptoms of dementia, which also needs, a management, a different kind of management. Not everyone might have that, but this is again something to look into. With few types of dementia, there can be some abnormal perceptions, as in people might have some visual experiences. So you might hear someone saying, well, I can see a red man, I can see a blue man, or I can, see some insects here. Or they can also have some false beliefs, as in they might think, well, someone's trying to do something to me. Now, these presentations are not just restricted to dementia. These can be also overlapping with few other conditions that we will talk about. So why do we need to understand this? Well, now that we've spoken a little bit in detail about the symptoms, we also need to know how important it is to diagnose dementia. Now, there are lots of conditions which can mimic dementia. The first one being normal aging process. So there are some changes in our behavior which we do not want to just attribute it to dementia. There's also a concept of mild cognitive impairment, which means there might be few difficulties that we've spoken about now, but they're not significant enough to affect a person's day-to-day life. So there might be chances of someone with a mild cognitive impairment, actually developing into dementia, and this will need proper monitoring by a professional. Now, there's also a condition called delirium or acute confusional state. This is where a person can lose their cognition. They might not know, where they are, what are they doing. This often happens when someone is admitted to the hospital. Say an elderly person just having a bladder infection or so, a urinary tract infection, admitted, or someone with pneumonia. They might present as though, the family start wondering what happened. Their whole, presentations change. They're having some hallucination kind of experiences. So this is different to dementia. This is because of the infection that's going on, and we need to understand, that there is a difference between the two, and therefore the diagnosis is very important. Again, depression is also very common in the elderly, and sometimes depression can also mimic dementia. So the reason I am talking to you about all these symptoms in detail is it is not as easy, just to go and diagnose dementia. It has to be done by an expert, and early we can carry out some screening tests, and then there will be a comprehensive cognitive assessment which would look at different aspects of their executive functions and memory. This needs a comprehensive assessment and only then coming to a diagnosis. Why do we need to act on time? Well, dementia is progressive, which means the symptoms that a person is experiencing is going to get worse over time. Treatment will vary for different types of dementia, therefore a proper diagnosis is extremely important. As dementia progresses, the behaviors can become more challenging. As in, you might find your loved ones asking you the same questions over and over. They might be pacing, they might appear agitated, their sleep and appetite might get affected. They might start having muscle weakness, they might have weight loss, and they might have mood changes. And this whole experience, can be very distressing, not only for the patient, but also for the whole family, for all the people caring for the person. Therefore, this warrants a comprehensive assessment, care, and management, focusing on that individual's needs and preference. I hope this introduction of dementia today has motivated you to at least go and read further about dementia and understand about it. Please also create awareness and watch out for these symptoms in any of your friends, relatives, or near ones. For more information, please visit www.alzheimers.org.uk. Thank you.